everyone, and welcome to our online wellness seminar, which we are hosting from here in sunny WA across the country. My name is Narelle Smith, and along with Daniel Burke, we are the WA Myeloma support nurses, and we are proud to be your hosts for this seminar today. Myeloma Australia acknowledges the traditional owners of country throughout Australia and recognises their continuing connection to land, waters, and community. We pay our respects to them and their cultures, and to elders both past and present. We always look forward to hosting our information seminars every few months because it gives us a great opportunity to meet with the myeloma community. The past few years, of course, have been a bit different with COVID-19, and we are really excited that more people will be able to have access to these great speakers, including people living regionally and outside of our major capital cities. I want to mention a couple of things before we introduce our first speaker. This seminar will be recorded and then available to watch if you have missed anything. The recording should be uploaded to the seminar page on our website within the next week. To access this, simply head to our website, www.myeloma.org.au, and click on the square button for seminars. It's in the middle of the page. If you are watching us live today, thank you so much for joining us. Whilst the seminar is running, you will have the opportunity to ask questions via our live chat function below the viewing window on this page. If you want to join it, you only need to put your first name or your initials. You don't need to identify yourself with a full name to join the chat. So please do join us. After the seminar today, if you have any other questions, please email them through to our nurses email on nurses@myeloma.org.au. There is also a contact number below this viewing window on the web page if you are having any technical issues with the online seminar whilst it's running today. Today, we have two amazing speakers in this wellness seminar, and I also urge you to stick around between the speakers to hear from my colleague Daniel. He's the WA of Myeloma support nurse who works with me about some of the exciting things that are happening at Myeloma Australia. So without further delay, it is my absolute pleasure to introduce our first speaker, Debbie Cooper. Debbie is an accredited exercise physiologist with 11 years experience working in clinical settings with clients diagnosed with various chronic conditions and injuries, as well as being involved in research across the cancer and paediatric domains. Debbie has a combined interest in cardiovascular disease and cancer, and was fortunate to be involved in the early stages of the Life Now research program while she was working at the Exercise Medicine Research Institute at Edith Cowan University here in Perth. Welcome, Debbie.
Thank you, Narelle. That was a very lovely introduction. So as Narelle said, my name is Debbie Cooper, and I'd like to thank you and welcome you to our exercise medicine and multiple myeloma presentation today. So extensive clinical research has recognised that lifestyle factors such as exercise play an important role in improving the physical and psychological effects of cancer and result in less severe side effects from its treatment. Exercise has been shown to be safe and effective and one of the best medicines people with cancer can take in addition to their cancer treatments. And it's important to remember that it is in addition to your normal cancer treatments. I'm going to talk about physical activity today and exercise, and you may hear that around. So what is the difference, and is there any difference? So physical activity is defined as any movement that is carried out by the muscles that requires energy. So in other words, anytime you move, you are being physically active. So every time you go to the shops, do your housework, do your washing, anything like that, do the gardening, you are being physically active. Whereas exercise is a planned, structured and repetitive and purposeful movement intended to improve or maintain physical fitness. So this is your yoga classes, your dance classes, tennis, any gym sessions that you might attend where it's planned and structured. This slide here is some research evidence from a organisation in Victoria called XMed Cancer. They do a lot of research in the various different cancers. Initially, it was funded by the Victorian government, but I think it's now privately funded. So their research has shown that people who exercise regularly can improve their health and well-being, improve state of mind and relieve stress, reduce the severity of anxiety and depression, improve your social function, increase your energy levels and thereby reducing some fatigue, improve your heart function and reduce the risk of heart disease, diabetes, osteoporosis, and other forms of cancers. And a lot of these conditions are either comorbidities already, or they can be side effects from the treatment that you're undergoing. We know that it can improve your lung function, improve and build strength through your muscles. And this is really important as we age. We also can improve strength in your bones and the function of your joints. And all of this helps maintain your physical function and makes your everyday activities easier to do. We can also improve your balance and reduce the risk of falls, which is really important in the myeloma population. All of this combined helps to improve your quality of life. We also know that physical activity and or exercise can improve enjoyment in life, reduce fatigue, and we're going to talk about fatigue in a minute, improve quality of life, improve lean muscle mass and strength, improve your aerobic capacity, and all aid in the recovery from treatment. Further exercise benefits have been shown to improve chemotherapy completion rates, reduce that hospitalization duration, which reduces that chance of further deconditioning, reduce the number and severity of symptoms and side effects. And I'm sure you've all experienced pain, fatigue, and nausea at some stage. Unfortunately, only 1 in 5 people diagnosed with cancer are meeting the National Physical Activity Guidelines, with physical activity levels not returning to pre-diagnosis levels post-treatment. So this means that you may have been really physically active beforehand, but you're no longer, once you've been diagnosed and gone through that treatment stage, you just haven't returned to that level. Unfortunately, this finding is consistent across all cancer patients. So what are the physical activity and sedentary behaviour guidelines? Well, it's important to note that this is for the general population, but there are some take-home points for everyone here. And it's important that we do any physical activity is better than none. So this first sentence, I think, is really important. It's by, if you currently do nothing, then it's really important to start and really build up gradually. So this could just be a couple of minutes a day, and then each day you try and improve that. We want you to be active on most preferably all days every week, and accumulate that 150 to 300 minutes, and that seems really daunting, but that's about 30 minutes a day of moderate intensity physical activity, or 75 to 150 minutes of vigorous activity, or a combination of both. And we'll talk about what's moderate and vigorous as I go through this morning. It's important to include muscle strengthening activities at least twice a week. And sedentary behaviour, we want to minimise this. We're seeing an impact on everyone's health these days as a result of sedentary behaviour that we saw in smoking a few years ago. So it's important to break up those long periods of sitting as much as possible and minimise the amount of time that you are sitting. So maybe jumping up and having a little walk around every time an advert comes on, or just making sure that at least every hour we're doing a few minutes of walking. So it's mentioned that 4 out of 5 people are not meeting the exercise guidelines. So what are the barriers? So research has shown that cost can be a really huge barrier, and you may be retired already, or you may need to finish work while you're going through your treatment, or just take some leave. And we also know that treatment can sometimes be very expensive. So expecting to have to pay out more money to exercise can sometimes be just not possible at that time. We also know that nausea, no one likes to feel exercise if you're feeling unwell. You could have no interest. I know I've got a husband that has absolutely no interest in exercising. Or you might not have a friend to exercise with, and we know the impact of having a buddy on motivation to exercise is. You could have another health condition, so you might have cardiovascular or heart disease or diabetes, and you think that that could preclude you from exercising. Your fatigue, again, like I said, we'll talk about that shortly. You could already have an injury, so a shoulder injury, knee injury, and you feel that that's going to stop you from being able to exercise, or a fear that you may get injured. Pain, which we'll know with myeloma patients experience a lot. We see an age-related decline in physical activity already. Or you could have a lack of knowledge, time, or confidence. Now, this could be a lack of knowledge in what to do, what sort of exercise to do, or who's the best person to talk to at the time. I mentioned fatigue. So this is one of the most recognized barriers to exercise. And we know that 70 to 100% of patients treated for cancer are affected by cancer-related fatigue. It's often reported as being distressing and disruptive to daily activities, often more so than pain, and can really lead to significant reductions in physical functioning and quality of life. The National Comprehensive Cancer Network defined cancer-related fatigue as a persistent subjective sense of tiredness related to cancer or cancer treatment that interferes with usual functioning. It can be characterized as being severe and distressing, persistent, not consistently alleviated by sleep or rest. So you may have had the best night's sleep possible, but you wake up and you can barely lift your arms or get out of bed. And it's not in proportion to the recent activity. So you might be trying to wash your dishes, but it feels like you're doing a marathon. And this all interferes with your daily activities and social functioning. There is, it's believed to be multifactorial in origin, the cause of cancer-related fatigue. So which that means is that it could be physiological or psychological. So things such as anemia, systemic reaction to tissue injury, infections, or sleep disturbance. We also know that chemotherapy, there's emerging evidence supporting the extremely detrimental impact chemotherapy has on health-related fitness. And what we see is an increase in fatigue and a decrease in quality of life. With muscle wasting, we see a decrease in physical activity, a decrease in food intake. We see imbalances in the rate of protein muscle protein synthesis and degradation. So that's the build-up and breakdown of muscle. All of this results in the muscle wasting and increases our risk of developing cancer-related fatigue. So traditionally, cancer treatment consisted of rest and avoidance of physically challenging activities. Now there is a big shift in this thought, thankfully, with exercise an integral component in cancer rehabilitation. And whilst this may sound counterintuitive, exercise really does reduce cancer-related fatigue. People may experience fatigue at any time from diagnosis through to treatment, and some may even experience it many months after treatment has finished. Fatigue can vary from day to day and from week to week, with activity levels needing to be adjusted to compensate for this variance. And that's where we can adjust your program to accommodate the different times. So it's also always good to keep kind of like a diary or something, and we can work out during the day when your fatigue feels the worst, and we work around those times and exercise outside of that higher period of time. So how does exercise help? So we know that aerobic exercise results in improved functional mobility. So functional mobility is our activities of daily living, the things that we do every day. We can improve your muscular endurance, which helps us do those activities, and increase our aerobic capacity. We know with resistance exercise, we can prevent muscle wasting, improve muscle strength and endurance, and reduce skeletal muscle metabolism, that breakdown again, and increase the size of our muscle fibers, all resulting in a decrease in cancer-related fatigue. This slide here is a bit of a combination of research articles that I put together. Unfortunately, some of them are a little bit old, but they were intervention studies, and they did undertake some exercise at different stages of treatment. And what I wanted to show you is that there is different things that can occur. So a lot of research showed that the combined exercise program, so that's aerobic and resistance during and after treatment, saw some really good improvements. We saw decrease in fatigue, decrease in mood disturbance, increase in muscle strength, and increase in aerobic capacity. We also saw some increase in cardiovascular, so significant increase in cardiovascular fitness, lean mass, total body fat, and some improvement through the bone mineral density, so in that hip and spine area. We also saw this during and after this aerobic resistance, balance and coordination, and most of our programs would be designed around those four components there. Decrease in sense of cancer-related fatigue, increase in physical performance, and what I really liked here is that increased sense of normal exercise-induced fatigue experienced in healthy individuals. We did see some improvement after treatment, just focusing on core strength and flexibility and a little bit of resistance. And after treatment, we did see some aerobic or improvement in muscle strength with just aerobic and flexibility. But for the most we saw, it was a combined program, both during and after treatment. So what are the exercise guidelines? So we know that unfortunately there's not a lot of research in exercise oncology for multiple myeloma at the moment. And when I knew I was doing this chat to you today, I reached out to a couple of well-known researchers in this area across Australia to ask if they knew of any interventional studies that were going on, because all the research I was finding was lots of systemic reviews or or literature reviews on what we should be doing, but not a lot of interventional studies. And some of the information I got back was that they are all trying to get lots of studies going. They all know that we need to be undertaking research or intervention studies in this demographic, but it's a very difficult area to get funding because it doesn't have the high impact costs that the large cancers like prostate and breast cancer have. It doesn't mean that they're not trying. And I know one of them here in Perth, he's been trying for the last 2 years to get an NHMRC grant. And they just have to keep tweaking it to make it more appealing to get the funding. So I don't want that to sound depressing. I want that to sound positive in that there are some really good researchers out there doing their really best to do as much research in this area as they possibly can. But the guidelines that we can work to, the American College of Sports Medicine put these ones out a few years ago. And what they did was they broke down the different areas, the different types of activity that you can do and the purpose behind them. So in low intensity, we'd be looking at an activity to maintain function or prevent deconditioning. And this would be where we'd be doing about 3 to 5 minutes of activity that is well tolerated several times a day at below or around 50% of your heart rate max. And what you want to do is gradually increase this exercise time and intensity. So I would say sort of maybe doing a 5-minute walk in the morning, maybe another one after lunch, and maybe another one before or after dinner, just to gradually build that up. And we could do, this includes things like Tai Chi, slow walking, swimming or yoga. We then can move into the more moderate intensity activities. So this is where we're starting to promote health. And we're looking at that accumulated 30 minutes most days. We're moving up into a little bit higher heart rate period. And we have this RPE scale here of 11 to 13. And RPE is our rating of perceived exertion. And it's just a fancy way of asking you how hard you found that activity. So it's a scale that we do from 6 to 20. And 6 is equivalent to a resting heart rate of about 60 to a maximal heart rate of 200. So the 11 to 13 here is about light to somewhat hard. And the activities that we'd be looking at there is some fast walking, swimming, water aerobics, dancing, cycling or gardening. And then we move into our high intensity training to promote fitness. So this is where we're doing 30 to 45 minutes, 3 to 5 days a week, a training heart rate of up to 90%, so pretty intense activity. And we're looking at the hard to very hard on that scale. And these would be things like our fast cycling, brisk walking, jogging, running, aerobics, and most competitive sports. And this is for a huge demographic here. This slide here is very, very busy, and the main reason, and it is specific it's general to all cancers, I should say, sorry about that. But what I wanted to point out was that there are some areas that we can see some cancers that are showing improvements in with there's 7 common that we can see in prevention cancers, and that would be your bladder, breast, colon, endometrial, esophageal, kidney and stomach. And then there's some that we can see an improving survival rate. But for our multiple myeloma, we can see cancer-related fatigue and health quality of life improvements with that combination program that we talked about, that aerobic and resistance, and including balance. And then we can see some anxiety and depression changes just with aerobics. So, and we would encourage even just getting out and walking outside in these for this for area here. But then we have the last one here is our lymphedema, but we also have bone health, which is really important. And there's a lot of evidence that resistance training can really help with that area for that. All right, so the Clinical Oncology Society of Australia, COSA, put out a position statement, and I think it was launched in May of 2018 at the Peter MacCallum Centre in Victoria. And their guidelines suggested that all people with cancer should avoid inactivity and return to normal daily activities as soon as possible following diagnosis. Take-home point there is be physically active as current abilities and conditions allow. And all people with cancer should progress towards, and once achieved, maintain participation in at least 150 minutes of that moderate intensity or 75 minutes of that vigorous intensity. So it's a working towards those figures. And we want to include 2 to 3 resistance exercise sessions each week. And it's important that these sessions are not back to back. We need to allow our muscles time, rest and recovery. So at least a 24-hour break in between. And these exercise recommendations should be tailored to the individual's abilities, noting the specific exercise programming adaptations may be required based on the disease and the treatment-related adverse effects, anticipated disease trajectory, and their health status. So they also recommend that exercise to be embedded as part of a standard practice in cancer care and viewed as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. All members of the multidisciplinary cancer team to promote physical activity, discuss the role exercise has in cancer recovery, and recommend people with cancer adhere to these exercise guidelines. Best practice cancer care includes referral to an accredited exercise physiologist or a physiotherapist with experience in cancer care. So what is right for you? So it's important to remember that it's not a one-size-fits-all approach. Appropriate exercise prescription for those living with cancer needs to be targeted and individualized by an exercise professional according to the needs of the patient and their particular cancer-specific considerations. And it's important to remember that sometimes a seemingly easy activity, for example, walking for 10 minutes, might feel like a moderate intensity during treatment. So it's really important to exercise at an intensity that feels right for you. And this is really important as you move through the different stages of diagnosis, treatment, and recovery. So our pre-exercise guidelines for our multiple myeloma patients is that it's really important that before you begin any exercise protocol, you should undergo a medical screening and a physical examination. Patients should have results from a recent bone scan, and the precautions and contraindications according to the ACSM should be followed, and we'll talk about those in a minute. Patients with bone metastases or lesions that have been medically cleared for exercise must follow an exercise protocol based on current guideline for bone metastases. And that these, be aware that these recommendations should be used as a basic foundation to establish an individualized exercise program tailored to each patient. And sorry, it's a bit hard to read this. Hopefully you can see it better than I can see, but these are the contraindications, and this is for clinicians and for participants. So we'd be looking at your hemoglobin levels, making sure they're not too low, your neutrophil count. If they are low, we'd be limiting the size of your group that you'd be exercising with and reducing any chance of a bacterial infection. And that's particularly important in our COVID environment that we all live in now. Platelet counts, very important. We certainly don't want to encourage any bleeding or cause any bleeding to happen. If you have a high fever, again, probably wouldn't be exercising at the moment with COVID, but we're certainly avoiding high intensity activities. Ataxia, dizziness, peripheral sensory neuropathy. We work a lot with patients with peripheral neuropathy. We just need to be aware of it, and we work around it, and we focus on balance a lot. If you've had some severe weight loss, muscle loss, we need to make sure that you're exercising at a really mild intensity and building back up. Dyspnea is an increase in shortness of breath, and we would be encouraging you to exercise to a tolerance. Bone pain, obviously we want to avoid any activities that are going to increase the risk of fractures. So any high impact or contact sports, any forward flexion and end of range of movement where we're stretching the arms or legs too far, we would be avoiding. Obviously nausea, we talked about that earlier, and extreme fatigue or muscle weakness. We have some further ones. So we certainly wouldn't be exercising if you've had surgery recently, if you have, like I said, the low immunity or low blood platelet count, nausea, or that severe reactions. It is possible to exercise at times with these. We just need to be able to tailor the program to minimize the risk. And that's why working with someone like an exercise physiologist or a physiotherapy with cancer training is best. So some specific exercise guidelines for patients with multiple myeloma, we'd be looking at 4 to 5 days a week. So you can see a similarity here. It's just starting slow and building up to what's specific to you. We're looking at 55 to 70%, 15 to 30 minutes self-paced walking or cycling. Resistance is suggesting 3 days a week, but about 5 to 8 repetitions. So that's about 5 or 8 times that you would do the activity for a length of about 20 minutes. And I've included some exercises there that you can easily do at home: chair stands, leg curl, knee extension. All of these exercises here have been chosen because they use or they strengthen the muscles that you use on a day-to-day basis. And they can be easily done at home. They don't need any equipment to do these. And so we also would encourage including flexibility. That is for the whole population. As we get older, we become less flexible. So trying to do that, but we wanted to make sure that they're slow, static, prolonged stretches that are held for 10 to 30 seconds. Now, I don't know about you, but 30-second hold is I find quite challenging. So I'd rather perhaps do the stretch twice, but maybe for 10 seconds at each time. And it's important to include a warm-up and cool-down phase as well. So I've included the exercises here that I mentioned, just to show you how simply they can be done at home. So sitting up and down in a chair, I would strongly recommend that when you're sitting back down in the chair, if you do have any spinal lesions, is to use the arms of the chairs as you lower yourself down, just to reduce the risk of any issues being caused. We can do all of these exercises nice and easily. You can add weights. You don't have to have dumbbells. You can use baked beans or something like that, a tin or a bottle of milk emptied with a bit of sand or water in. So you certainly don't need to have any fancy equipment. Patients with bone metastases have traditionally been advised to avoid high-intensity aerobic activity, resistance training, or impact training, which is weight-bearing. So because of bone fragility, the possibility of exacerbating the disease, or the inability of patients with advanced cancer to benefit. However, extensive research has shown that this only hastens decline, and this rest strategy is not suitable. So with bone, concern with myeloma in regards to physical activity is the fracture risks related to bone lesions due to frequent bone destruction. A risk assessment, like I said, should be undertaken, and it's important to follow weight-bearing guideline precautions for patients with bone metastases. So a report by Smith in 2015 reported that patients considered at risk with large lytic lesion of the large bone or extensive lytic disease in the pelvis underwent cross-sectional imaging with CT or MRI and were either referred for surgery or radiotherapy. Not at risk were cleared to exercise, while some at risk underwent surgical fixation first. So best practice, the International Bone Metastases Exercise Working Group. So this is an exercise group, and this report here is hot off the press. So January 2022 it was released. And they asked the question of what was the best practice for people with bone metastases. And their answer came up with, the answer they came up with, was that people should be supported and encouraged to engage in regular physical activity, including structured exercise to obtain the well-established general health benefits and as a strategy to manage side effects. Perceived risk of skeletal complications should be weighed against the potential health benefits in consultation between the person with bone metastases, the healthcare team, and their exercise professional. Their review came up with these 5 key recommendations. A lot of it we've already talked about: performing a risk assessment, consultation with your medical team. So it's really important to establish bidirectional communication. The exercise professionals who are best to work with you, as we've said before, physiotherapists or exercise physiologists. We need to judge whether exercise testing is actually required, and then follow the guidelines for the International Exercise for Cancer, focusing on postural alignment, controlled movement, proper technique, and consideration of the bone lesion location and presentation. Their overarching recommendation was that regular exercise has the potential to maintain or improve physical function and health-related quality of life in people with bone metastases, and the perceived risk of skeletal complications should be weighed against the potential health benefits. So these were some of the guidelines that were specific for the cancer patients. Again, same things that we've been talking about: avoid contraindicated movements, so that hyperflexion extension, follow specific guidelines on modify exercise programs, and be aware of signs and symptoms of bone metastases. Also, that one go? Yeah, so stem cell transplantation, people should be encouraged to do a home-based exercise, ensure that a full recovery of the immune system before returning to gym facilities with general public, start light, short durations but high frequency, and progress slowly. Intensity and duration should be adapted on a daily basis based on the individual's presentation. So the future of exercise oncology, so what we're moving towards is exercise medicine, where a patient is diagnosed, their key issues are determined, then we prescribe the exercise so that they are internally producing a medicine to improve their chances of extending life with cancer. So this is like when you're diagnosed, your key issues are determined by your team of specialists, and then you are prescribed the treatment that is suitable for you. So the Catalyst, I'm not sure if everyone saw the Catalyst story way back in 2016, but it was a really interesting story where they showed different mechanisms where exercise actually helps. When I first was started in research, we were basically focused on improving the side effects, but continued research has shown that we actually can have an impact at the cellular level. And there's 2 mechanisms. So the first one is blood flow. And the goal of treatment is to get chemotherapy agent to the tumour site. However, tumours typically have a very poor blood supply. Physical activity increases blood flow, allowing more drug to the tumour where it's needed. Exercise immediately before or after treatment can influence the circulation of the blood, allowing normal chemotherapy to target cells. The other mechanism is our immune system. So we all have potential cancer cells in our body, but the body works to find and eliminate by calling in these natural killer cells. So when we're exercising, our body releases adrenaline, which signals the release of these natural killer cells, and the muscles to release interleukin-6. Interleukin-6 seeks out these tumour cells and directs the natural killer cells to target and eliminate the tumour. So what that means is that the exercise is allowing the upregulating of the body's own immune system to generate its own anti-cancer drugs, which personally I think is so exciting. So let me ask you a question. If someone offered you a wonder drug that helped you lose weight, keep it off, slashed your risk of chronic disease, prevented or treated mental health, extended your lifespan, and could be obtained for free, would you take it? The good news is this drug already exists, and it's called exercise. So it's also been shown that regular physical activity is linked to significant reduction in heart disease, type 2 diabetes, some cancers, depression, anxiety, also shielding against cognitive decline, dementia, and improving bone density. So physical activity is the single most important thing on a daily basis to improve your health, and there's nothing else that gives you all those benefits. It's often been said that if all the benefits of exercise could be encapsulated into one pill, it would be the most prescribed and taken pill around. So wouldn't it be that easy? But unfortunately, sometimes the solution can be the simplest, yet the hardest thing to do. However, it does yield the best results. So I'm going to leave you with this little exercise, this little slide here. Thank you so much for listening to me today. And hopefully if there may be if anyone's got any questions. Thanks, Narelle.
Thank you so much, Debbie. It was such a fantastic presentation. I really like the last slide. We do have actually a few questions. The first one has come from Chris, and Chris says, how close to previous levels of fitness can someone living with myeloma expect to gain after a diagnosis?
Look, the more fitter that you are pre-diagnosis, the quicker we get you back to those levels. So that's where there's a real push now to get cancer patients doing what we call prehab. So exercising and getting you as fit and as healthy before you start any treatment process, because we know that improves your chance of recovery from that treatment, but it also allows us to get you back to that level of fitness before post treatment. So it depends on where you're going. Having said that, sometimes we see the most changes in the people who have started off the lowest. We do see more changes then afterwards. So it just depends on the level of fitness going in. Does that answer that question?
Yeah, I think so.
Hopefully.
I do have another question that's a little bit similar, but it's actually to do with while you're on treatment. Yes. So Bev asked, is it possible to build muscle and bone strength while on treatment? So she's on a trial at the moment. She says she's struggling with fatigue, joint and muscle soreness, both before and after exercise.
Okay. So I guess it depends on the condition that you started in, but we can definitely see small improvements. We certainly don't. What we want to see is the decline. So the soreness, how long, depending on how long the soreness lasts, sometimes it's quite often that we are sore after exercise for 1 or 2 days, but then it starts to reduce afterwards. We certainly wouldn't be wanting to see joint pain. We have to balance that between, is that the condition or is that the exercise that we're doing? So it would be maybe adjusting the program to try and reduce that down. But the goal is that we do want to see improvements, or at least stopping that decline in muscle strength if you're exercising whilst undergoing treatment.
Thank you. And finally, you mentioned that there is a lack of funding towards myeloma-related exercise studies at the moment, and you did have a really good look for it, I know, when I was speaking to you before this presentation. Yeah. So in the future, if people in the myeloma community are looking to find some new and emerging studies that might be up and running, where could be some of the places that they could go looking for that?
Do you mean as in institutes or?
Yeah, so maybe tapping into some of those researchers or the institutes that might be running them.
Yeah, so I know Peter McMack Centre in Melbourne is a hugely regarded institute. We've also got the Exercise Medicine Institute here, Exercise Research Medicine here at ECU in Perth, and there was one of the researchers, Professor Robert Newton, that I spoke to. There's one there is, and his name is escaping me at the moment, in Sydney, the Life Oh, I do apologise. I should have had that written down, but I can certainly provide some information for that if people want to contact me via Narelle or something like that. But there are various different institutes that are highly recognised for these areas, and these were the people that I contacted to ask about them. So yeah, I can certainly get you some information, further information from that.
That would be fantastic. And as I said at the opening of this seminar today, if you are wanting to get that information, you can email us at nurses@myeloma.org.au, and I can pass that on to Debbie.
Absolutely. And the same as if they're looking to find like an exercise physiologist or a clinic that they could go to, I can direct them to different sites to help them with that if they want to contact you as well.
Fantastic. Thanks so much, Debbie. Thanks for your time. Thanks for sharing all of your amazing knowledge and experience in the exercise realm with our community today. I'm going to let you get on with your day.
Okay.
And I'm going to move on to Dan now. So I'm going to hand the hosting reins over to him. Thanks so much, Debbie.
My pleasure. Thank you, everyone.
Change seats.
Okay, thanks very much, Narelle. I know, Debbie, you have to run and you have to continue your work at your busy practice. So we really appreciate the time that you've made for us today. And thanks once again for your very informative presentation.
My pleasure. Thank you.
Thank you. And just as we get ready to introduce our second speaker, I would just like to give you a couple of updates from Myeloma Australia. We would like to invite you to join Myeloma Australia's first ever national fundraising and awareness walk on this Sunday, the 27th of February, 3.8 with a mate. And it's our way of further supporting 38 mates who are diagnosed with myeloma each week in Australia. If you haven't already, you can register at www.myeloma.org.au/38 with a mate. And did you know that My Conversations is Myeloma Australia's podcast series, hosted by our expert myeloma support nurses? In My Conversations, we chat to people living with myeloma, interview experts in the field, and deliver educational material on elements of this specialty area. This podcast aims to support, inform, and empower those living with myeloma, their family, their friends, and healthcare professionals. So if you have a question or would like to suggest a topic to be discussed, please email us at nurses@myeloma.org.au. Myeloma Australia also have 2 new resources available for downloading that we're also able to post out to you in hard copy format. Understanding Myeloma is a comic book designed and written specifically to help children understand myeloma. We also have a new information booklet for people living with myeloma, their families and friends, and healthcare professionals on relapsed and refractory myeloma. These resources, including others such as our comprehensive guide to myeloma, living well with myeloma, and managing peripheral neuropathy, as well as other information and treatment fact sheets, are available on our website in the patient and carer resource section. Our toll-free telephone support line is staffed by our specialist myeloma support nurses who have access to up-to-date information on myeloma, its treatment, side effects, management, and available support services, and as well as living well with myeloma. If you are a person living with myeloma, a carer or a family member or a friend, and you have a question relating to any aspect of myeloma and its treatment, you may like to speak to one of our support nurses on the telephone. The telephone support line is available Monday to Friday, 9 a.m. to 5 p.m. Australian Eastern Standard Time, where your call will be directed to the myeloma support nurse on duty. And if a nurse is not immediately available, your call will be returned as soon as possible. So to stay up to date with the latest information on myeloma and be informed about upcoming events, seminars, local support groups, receive newsletters and updates, please subscribe to the Myeloma Australia mailing list by visiting myeloma.org.au and clicking on subscribe at the top of the page. So it is now my pleasure to introduce you to our second speaker, Clemency Nicolson, who is an accredited practicing dietitian with the nutrition specialist at Innaloo, WA. Clemency has worked in a range of health settings since graduating as a dietitian over 30 years ago, working in hospitals, public health and private practice settings, as well as teaching nutrition at Curtin University of Technology, have all informed how she practices and added to her experience. She now works with clients in groups and individually to overcome their individual barriers to change that will improve practical management of their health. Her particular areas of interest include nutrition and eating for individuals living with cancer and gastrointestinal health. Her main practice is the nutrition specialist in Innaloo in Perth. Clemency's topic is one that may not always get the discussion time it deserves in support groups, but is an extremely important factor in our well-being and our ability to manage the effects of myeloma and myeloma treatments. Clemency will now present on managing nutrition with myeloma, and I thank you very much, Clemency.
Thank you. Thank you, Dan, for that lovely introduction. So we're going to be talking today about multiple myeloma and eating, and I've specifically made the title about eating because we eat food, not nutrients. People often talk about nutrients a lot, but we eat food, which are a mixture of nutrients. So the role of nutrition in multiple myeloma, our goals are improving the quality of life, the well-being, the functional status of those people living with multiple myeloma, as well as increase survivorship and progression-free survival. So today we're going to cover some general recommendations for cancer and maintaining good nutrition, as well as looking more specifically at the treatment phase of our management of multiple myeloma and our eating guidelines there, where we can minimise the impact of side effects potentially, and we want to follow a nutrition program that allows optimum treatment regime guidelines to be met. We'll take a look at some food hygiene and a little note about supplement use as well. So I often get asked, is there any multiple myeloma or other cancer for that matter cure from a food or nutrient supplement? The basic answer is no, not for any cancer type. Research does continue, however, for a range of cancers, trying to find out what gives a positive effect, but also what gives a negative effect, whether that's looking at a particular nutrient or a plant chemical concentrate on their own, but rarely on their own, because usually that's in combination with a treatment. Other manipulations of diet might be through research on time-restricted eating with chemotherapy, radiotherapy, and immunotherapy. A new area that is getting some attention is examination of the microbiome composition in individuals living with cancer and specifically with multiple myeloma. That's a new field, and trying to determine if there's a role, if any, that we can, or a benefit that we can get through manipulating that microbiome with prebiotics and probiotics. So specific research to multiple myeloma is not a lot necessarily. However, there is some very important work that's been done, and one of the recent looked at studies by Shapiro and colleagues found that the factors that impact the quality of life and the functional status for your community are these listed below. Nutrition, which I've highlighted because we're talking about that today, but also activity, as Debbie gave the excellent presentation on, sleep and weight management. And our goals in looking at these things are to moderate the effects of treatment. There's also some interventions looking at nutrition and exercise with bone marrow transplantation, and the early outcome of that is beneficial with those patients. So what about online information? It's just a minefield out there. There is a relatively small amount of accurate information and a huge amount of misinformation. So I recommend people try and keep their searches to legitimate myeloma and cancer institution sites worldwide, Centre for Disease Control in the US, and the excellent World Cancer Research Fund, which pools all the research and has a wonderful continuing update project from which they make recommendations about lifestyle factors. You can also look in the Cochrane Library and can contact qualified accredited practicing dietitians who work in this space. We're really wanting groups that will look at the evidence from the best run studies or review the studies, excluding studies with poor design or low numbers or so on. What we don't want to focus on are the poor sources, which are many websites, blogs, chat pages and Instagram pages, where there might be some fairly outrageous claims made about the role of nutrition in cancer recovery. We may find that studies may be cited, but typically it's often a study, or if we looked into it, it's a study on cells in a test tube or perhaps a rodent study. Occasionally, there may be a human study involved, but as we'll look and see, the human studies will come up with a range of results, and you can just pick out perhaps the one positive result that came from a particular nutritional intervention, and you could ignore the 25 negative results and cite that one study on your web page there. So it's very confusing for people, and I appreciate it's also quite stressful. But remember, we're after the evidence that comes from looking at the body of the work, not just one little study there. Now, this next slide is really provided just so you can see what the process of researching something involves, because it's quite important to know that initially studies are done on cancer cells in a petri dish or in a test tube. If there's enough reproducible positive results with that, then it may progress to an animal trial. If there's enough positive results with that, it may progress to human trials, which go through a Pawson ethics committee, because our main goal is not to make people's situations worse. So we have to double check the quality of the data. Then there might be some exploratory studies and pilot studies. And so websites that might say studies show could be referring to studies in a petri dish, could be referring to a rat study, rather than looking at studies that have been through the full rigor of human trials, where a lot of evidence is required at each phase that people are going to be benefited. So I just want you to be aware of what the process is there. So many of those websites, wellness sites and so on, there's none of the rigor with the research they're citing, and it's often back at that very early lab stage that they might say studies show, and that's what they're talking about. So just want you to be aware of that. So the worldwide recommendations for eating and cancer are not specific to multiple myeloma, but they do apply to this condition. Each country has an expert body, and they also use the work of the World Cancer Research Fund and other international bodies. And today we're going to take a look at that. We're also going to put our focus on the inclusions, because that's where we get our most benefit from, by looking at what we want to include, not focusing on don't eat this, don't eat that. There is nothing you can't eat. You'll be pleased to hear, I hope. So across the board with cancer and nutrition, including if you look up on most myeloma sites, Myeloma Australia, Myeloma UK, etc., you'll get the advice to follow a balanced diet. That's a 5 food group based diet, and the particular benefit we get from doing that is having a high plant-based eating. Along with that, the recommendation is that we have a high food-based nutrient intake, not extracts, not supplements, but a high food-based nutrient intake, and that's what we'll be focusing on today. Along with that is the recommendation for a lower intake of the ultra-processed foods with the high sugar, high levels of poor quality fat, high salt, and high refined flour levels that those foods provide. We'll also check our animal food intake. There are guidelines around the usage and inclusion of meats. So I just want to provide a little note that if you're looking at following a regime that has a whole bunch of these things in it, that is a red flag. So just be aware of that. Let's look at this balanced diet and what that means. With our nutrition, we're aiming for as high quality diet as you can possibly manage. And at different stages of your therapy, you may be able to manage more of these 5 food groups and at other times less. But we'll try and work out some of the ways that we can get them in through most stages of your therapy. Our 5 food groups, eating them with a Mediterranean accent, that is well recommended across the board. It's mostly studied in other cancers, but it always comes out showing health benefits. And that's health benefits for the whole body. There's also been some evidence to show that there's lower all-cause mortality after treatment with breast and some other cancers. Unfortunately, multiple myeloma didn't have large numbers in that study there. Breast cancer and often colon cancer are those most studied due to the number of people affected. And the Mediterranean accent on our food intake is delicious, so that's another bonus. What we also need to recognise that indulgence foods, there is a place for those. We all enjoy a little of those. It's all about the frequency and the portion size of our intake. So we'll talk about that as well. So just in case you're wondering where the information for a balanced diet comes from, the National Health and Medical Research Council provides that information through reviewing periodically the nutrient reference values. And you can look at all this. So if you enlarge this screen on your home computer, you'll see the reference to look up. You can click on each of the nutrients there, and it will open up to provide all the evidence and the studies in great detail for the requirements at different ages and stages of the life cycle. So it's very detailed. That once all of the nutrients are covered there, it is then modelled into what would the eating pattern look like if we were trying to meet these things. And that's where we come up with the healthy eating guidelines. And so it covers our 5 food groups, and you can see that there are different numbers of serve recommendations, though often they're the same for men and women, and the serve recommendations may vary depending on what age group you fall into. So this is for adults we're looking at here. So I've just taken a screenshot, but we will provide this information that Myeloma Australia can push available to members so they can access this PDF that we have. So I've just taken a couple of screenshots. You can see that our recommendations there are for the vegetables and the fruits. We all know the 5 and 2. That's a common theme that we hear when we're talking about good nutrition. We've also got the grain-rich foods there, and we've also got the protein-rich foods with the meats and alternatives, and we've got the calcium-rich foods with the dairy and alternatives there. So we use this to form the basis or inform the basis of our balanced diet. So by doing that, you would have seen that there are large numbers of serves coming from the fruits, vegetables and grain groups. As well, we have the opportunity to choose a range of plant foods in the protein-rich group and the calcium-rich group. The high plant eating benefit, it's way more than just the vitamins and the minerals and the fibre role for our body. The phytochemicals are the key to that. These plant chemicals, you would have heard of one group that's often talked about, perhaps the antioxidant group, but there's such a large number of these things that we're discovering all the time that have many, many benefits. Antioxidation is just one of them. There's a readily accessible list that is being continued to be added on Wikipedia. I just put the link if you want to look at it. You don't need to, it's just I'm going to give you a bit of an idea of how many of these things are. To screenshot it was going to take 7 or 8 screenshots. Another terrific little reference is in Catherine Saxby's book, Nutrition for Life, discussing the phytochemicals. When I did a few screenshots, it's just for you to get the idea of the vast numbers of these. So that's about half of the information on the Wikipedia site, which is not exhaustive. There's more and more being added all the time. So just so you know, it's these compounds that seem to give us the big benefit with our health. And that's why eating whole foods that contain a wide variety in each food is the way to go, rather than having one concentrated thing as a pill in a supplement. So if we're trying to boost up our plant intake, a great way to do that is start by increasing the plant diversity. We do all tend to get a little stuck in a rut with our vegetable, fruit, grains, nuts and seed choices, or perhaps we're only using some of those, or we always buy the same veg or the same fruit. So let's see if we can increase the number that we might use in a day or in a week. And by doing that, by having more of those things for our meals and snacks, it will tend to reduce, just quite naturally, the low nutrient foods. And a big key to this is changing our shopping and surrounding ourselves with the sorts of foods that we want to be including. It makes it much more easy to make that choice when we're putting a meal together or a snack. Right, let's get into our 5 food groups. So I'm starting with the protein and iron-rich foods because during our treatment phase, as we'll see, really hitting the protein targets is a great way to help recover from your treatment and maintain your health over your therapy journey there. So we can choose the protein-rich foods from a range of sources. We have plant sources, and obviously increasing those plant foods as a proportion of what we're using for our protein-rich inclusions would be a great way to increase some plants. So building up our use of legumes and getting a better little library of some legume recipes that are easy is a great thing to do. Tofu, that's the serve size there. So each of these is showing what 1 serve is. And remember, we want to meet our target, which will be somewhere with between 2 or 3 serves, depending on our age and gender. We might use nuts and seeds or pastes of nuts and seeds, and we can use the nut meals as well as in our baking, and that helps us to increase the protein in our diet. We also have the animal sources, and 1 equivalent serve is shown there. And a mixture of these things will be a great way to meet your protein guidelines. So that's one of the groups. We've got our decision about whether we want to include a lot of animal foods or not. It's really up to you. It's the protein and the nutrients that we get from this group that is the key. The guidelines around red meat intake are to minimise processed meat. So all those deli meats, it doesn't mean you're never going to have another slice of bacon or a piece of ham, but just reduce the frequency of that so it's just occasional use. In terms of red meat, lean red meat intake, we have these figures. There's the World Health Organization recommendation of not exceeding per person 455 grams per week. The World Cancer Research figure, when they examined the research, came out at 500 grams, but you can see that that's basically in the same ballpark. Interestingly, the white meats are not limited, as the association of increasing health risk with increasing consumption was not seen with the poultry or the fish groups. Some people choose to be vegetarians and minimise their meat intake. They may include eggs and dairy foods there as part of their protein mix. And some people choose to be vegans with no animal foods. We'll talk a little bit about that afterwards. Easy ways to increase our plant protein may be to use some of the simple options like the canned legumes that we can access. And about half a cup of the additional of the legumes being added to the meal that we're making is about half a serve of our protein group. And there's a range of ways we can add them to foods we're already making. And I usually recommend to people who are new to this group that they may start just putting small amounts in dishes they already make, like casseroles and curries and soups, and gradually increasing the level of the legume there as they get used to that taste. The easiest legume to put into a soup is the red lentils. They cook away to nothing. Another way we can use some legumes is perhaps with the frozen edamame, the Japanese little legume there, and that's great to use in stir fries. Just a note of caution. People sometimes say, oh, I eat hummus, but just so you know, of course, the chickpeas are quite diluted down with all the other ingredients there. So it's not a high protein food. It's fine to use it. It's great to have as a snack, but it's not a high protein inclusion. Other ways we can boost our plant food intake. Plant protein intake is using the tofu, perhaps in stir fries or soups. And there's even some mixes that make it quite easy to boost our legume intake, like falafel mix, for example. And nuts and seeds, I've just indicated a range of ways that we may add those to different foods that we eat in a day. Vegetables, your recommended intake will be 5 or 6 serves per day. So we know it's the vitamins, the minerals, the fibre, the phytochemicals, and incidentally, a low kilojoule intake that gives us a lot of benefit. We can use fresh vegetables, we can use frozen vegetables. Frozen vegetables I'm often asked about. They're highly nutritious. They are frozen, snap frozen, pretty much at the source of where they're harvested from, or not far away, or not long after. And so they retain a very high nutrient intake. They are blanched, so they're partly cooked when we get them. The affordable vegetables are the seasonal ones, and they're also at their nutritional peak, so that's a bonus. We can eat vegetables raw or cooked. Neither is more beneficial. People often think they need to be on a raw food diet. It's a bit of a surprise when I tell them that actually cooking our vegetables enables, in many cases, more of the nutrients to be digested, and that's because we break open the cell walls of the plant and the nutrients are put out into solution and easily absorbed into our bodies. And there's an indication of the serve, what a serve size is there as well. So we want to eat the rainbow, and you would have heard that before, not just from me. So the colour is from the phytochemicals, and different classes of phytochemicals are showing there with relation to different colours, whether it's the greens, the yellows and oranges, the purpley blues. There's a couple of different types of those as well. And those colourful fruits and veg are giving us a massive benefit and a big dose of these phytochemicals. Ways to increase. I usually recommend people start stir frying more because that automatically provides a large vegetable serve. Adding them to eggs or toffee if you're scrambling those things, perhaps for your breakfast or a quick lunch or dinner. Making salads with cooked veg or raw veg, using some of the frozen veg for that as well. With soups, that's an easy way to get a couple of serves of vegetables for many people, and we can always throw in a legume. It's great to use something like a mug of soup when the weather cools down for a snack, and we often forget that that's something we could use as a snack. Adding more vegetables and legumes to the casseroles that you might cook, putting a few of the easy to eat crunchy salad items on a snack plate when you're having a snack. And I often focus on using the easy vegetables. So things like the shredded vegetables with the coleslaw mix, those types of products, you can actually just stir fry those, or you can throw them into soups. You don't have to do all the work yourself. And that's the same with the frozen vegetables as well. It really reduces the prep time. If we're looking at our fruit intake, 2 serves per day, I'd really like to stress it does not have too much sugar. Enjoy your couple of serves per day. It provides fibre, vitamins, and these wonderful phytochemicals. It's the snack we want when we want something sweet. Eating them fresh or frozen as a whole fruit will give us the best benefit, but we might like to have a bit of dried fruit or a small amount of juice. The serve sizes are shown there. We're going to talk more about sugar later on, so I'll come back to that one. I know people have interest in that. The grains. We really want to focus on our smart grains that give us the nutrition and the fibre and really help us manage our blood sugar levels. So those slowly digested choices, we call them low GI, that's low glycemic index. And the serve number we need probably depends on our activity level, but we have a ballpark figure of 4 to 6 serves per day. So what do we mean by the smart carbohydrates? We really mean the high quality carbohydrates, for the reasons that I just said around the blood sugar control and the nutrition. We want to avoid poorly managed blood sugar levels. We know that can increase cellular damage, and that can provide a health risk for us for a range of health conditions, not just with our cancer. So it's the quality and the portion size that we're after, so we get the majority of benefits that they'll provide as a grain, a plant food. When I'm trying to describe what I mean by slowly digested foods, it's best illustrated with this slide here. You can see what we want to be on is the green line, where we might choose to eat a carbohydrate containing food. It will gradually break down to little glucose units, which go into our bloodstream over the next couple of hours after eating. We'll see a slight rise in blood sugar there, and our body will easily bring that back under control. What we don't want are the foods that digest much more quickly. The little glucose units will be quickly going into our bloodstream and cause that big blood glucose spike. Our body fights hard to bring that down and puts a lot of insulin into our system, and is often working so hard that we'll tend to overshoot the mark. And of course, once our blood sugar goes quite low, that's when we'll find ourselves getting tired, looking for a snack, and depending on what we eat, we might just go through that process again. So we're really aiming to just have these very well controlled blood sugar levels through our choices in our carbohydrate foods. So I'm just showing you a range of the lower glycemic index nutritious foods. Most of our fruits digest slowly, and we'll follow that same profile with the blood sugar. We've also got the more the brown rices, and some you can buy specifically with low GI. They are the breed of rice that has the most slowly digested starch. Our legumes are slowly digested. Our dense grain breads are also, as is the lactose in our dairy products. The pasta is also slowly digested, which is good news. Sweet corn, sweet potato, and there is a particular type of potatoes, the charisma potatoes, but also the low carbohydrate potatoes, which meet that guideline also. There's a very nice downloadable resource from the Baker Institute, and I like to encourage people to try and get their lunch and dinner having ingredients in proportions that look a bit like this, which is basically half of what's in your meal being the vegetables, a quarter being from a protein-rich food, and a quarter being from one of our smart carbohydrate choices. Doesn't mean everything's going to sit on the plate like that. You can cook it all into stir fries, make soups, have a salad. It doesn't really matter, but that's the ingredient proportions. And so you can get that through the Baker Institute there online. So what about sugar? Don't panic. There's some hysteria out there around this. The World Health Organization has looked into this a lot and come up with these following recommendations. Now, it's all about free sugar or added sugar. That free sugar is really where we've got a sugar concentrate, and added sugar is where we might have added sugar by the manufacturer, the cook, or the consumer. The evidence shows that a reduced intake of these free sugars or added sugars throughout the life course will improve health. That's a strong recommendation. And so the recommendation is that we consume less than 10% of our energy intake from these free or added sugars. That's a strong recommendation, and there's probably a further benefit from reducing that to 5% of total energy intake. What does that mean? So let's have a look at what that means in practical terms for most people. That we can include up to 6 level teaspoons, not massive teaspoons, level teaspoons of added sugar, any type, over the day, or less than that. You don't have to have that. That's our maximum. That's within our WHO guidelines. And where I like to recommend people use these sweeter foods is to help them consume a more nutritious food. So if you like your grain toast with jam or honey, enjoy. If you like your yogurt a little bit sweet, enjoy that also. Have some brown sugar with your porridge, or some honey, or some maple syrup. If you like making those fruit and nut balls, please go ahead and do that. Sorry, I've doubled up on the porridge there. If you like a few squares of dark chocolate, then please enjoy, or it may be something else that is your favourite, and having a small serve of that is no problem for your health. And please remember, a bit of what you like is good for you. Over there in the added sugar blue column, it's just reminding us there's so many ways sugar is added as an ingredient. So we're not just meaning that we say sugar on the ingredient list. There's lots of others that we need to look out for. What about sugar? Again, there's many claims made out there over internet land. And what we need to remember is that cancer metabolism is very complex. The development of cancer and the progression of cancer is such a complex area. We know that cancer cells, yes, they do metabolize a lot, and they will have a higher glucose uptake than the average healthy cell. However, they adapt to a range of fuel sources. They can also use fat as a fuel, and they can use protein as a fuel there. So for people to simplify a message to avoid sugar and stop cancer is so far from what the research suggests. It's so not scientific. So if anyone's telling you that, it's a real red flag as to their protocol they're recommending. It often sounds convincing because they can throw in a bit of scientific language, but what we're really after is following the body of evidence as the research develops in this field. Now, that's not to say that we don't want to lower our ultra-processed food intake over our life. We know that having a high intake of those foods and a much lower intake of the sorts of foods we've talked about already with our 5 food groups is associated with increased cancer risk, and many adverse components are in those foods. So it's not just the sugar, it's the fat quality, it's the salt, it's the additives and so on. So there is research into modifying carbohydrate intake. It's just the hype is so in advance of what the studies are actually showing. And the areas of research looking at both improving the treatment efficacy in particular and cancer survival rates are around the use of the ketogenic diet, where carbohydrate foods are avoided, rich foods are avoided, fasting, where all foods are avoided, recognizing that both of these things have a high risk of malnutrition, and there's a lot of non-completion in the small number of human trials that have been done so far. Most of the studies are right back at that early research point that I showed you on that research slide with the cell culture and the rodent studies. There have been very limited human pilot studies. That was that other group, really sort of before we get to the phase 1 and 2 sort of trials. There's not so many of those. So the issue is that there may well be something in this, and we're hoping to tease that out, because the problem is some cancers progress much more rapidly on a ketogenic diet. For example, they're fat loving. So we need to start teasing out if there's anyone or which groups these sort of eating approaches will benefit, and which people will not be benefited by this at all, and which will be harmed by this. And so that's the sort of information that we need to wait for. Calcium-rich foods, moving away from our grains there and their derivatives. So our calcium-rich foods, we have the dairy foods, which are high in calcium and protein. We can now get a range of plant milks. These are not routinely calcium fortified, so we need to check the label and make sure that they are calcium fortified. So the calcium will be shown on the label in the ingredients. They are low protein also, except for the soy milk or some pea milk and high protein almond varieties there. Dairy intake creates a lot of confusion also. Is all dairy okay? Which types? Basically, dairy is a broad field, and so it's quite hard to study. There's some protective effects, or is there some increased risk? It appears to be very specific to the cancer type, but in a nutshell, I'm not sure if I put it on the next slide now. So in a nutshell, the breast cancer research, it seems there is quite a significant protective effect, but for prostate cancer, there is limited suggested association of about an average increase in 9% risk with a high dairy intake, not a modest, but a high dairy intake. But the breast cancer work so far is showing strong protection, as is colorectal cancer, and that's what we know so far, but you wouldn't be feeling with that out there on internet land. Righto, indulgence foods, they're included on this handout, and we just want to eat them in the small amounts. As I said, there is nothing you can't have. So eating and treatment, our goal is here is to support the treatment program and quality of life to meet the nutrient requirements with our emphasis on protein, and so really enable that individual to get through their therapy. We want to hydrate, and we want to look at the side effects for intake. We want people to feel better, function better, and get through their treatment cycle number. The issues, and I don't need to tell you these, that treatment may cause include the following, with fatigue being one of the worst, and Debbie's presentation included a lot about that, which was wonderful. Various taste changes and gastrointestinal changes, mouth changes, nausea, and so on. And also we have the added effect of being quite an anxious time and perhaps some depression there, which can alter people's intake. So what we normally see over studies with cancer and intake is that generally people reduce the legumes and fruits and vegetables, or they might be following a regime that can end up being not quite as well planned as we would like, or there may be a very restrictive practice that they're doing. So we really want to meet our nutrition goals when we can and choose the foods you can manage the best at any particular time in your treatment. Let's have a run through with the side effects there. So there's quite a lot of information in these slides, and I'm not going to talk about it all because there's not time today, but we're going to leave the slides because they will be available there for you to refer back to should you get one of these side effects and want to know a little bit more. Fatigue is the most common, so I'm going to speak a little more widely on that, where people are feeling not only physical fatigue, but perhaps mental fatigue as well. And we find if people have been losing weight that we really want to aim to stabilise weight at this point where they're noticing that side effect a lot. So we try and get the focus to be on eating well when the appetite is the best, as there will be a time in the day where there's an improved appetite generally. We like to focus on having snacks within reach that are of the more nutritious variety and small, frequent eating opportunities there. As we heard previously too, moving and taking some short walks can help combat fatigue. And in between time, we also want to look at prioritising rest. I always encourage, if there's anyone supporting you, to have others prepare the food and definitely have others to do the housework. So for increasing energy level, we've talked about the quality food. We know we also need a few other things. Sunlight adequacy has been found to be important. Maximise it, getting that optimum sleep, 7 to 9 hours if we can. The exercise we mentioned and using our relaxation techniques there can all help with that fatigue. The taste and smell changes, there's a range of things going on with that, where we might find the mouth lining is damaged by the agent we're using, and the cells now perceive different tastes, whether it's metallic, salty, bitter or sweet. Those changes, tastes will have changed. So I'm including a range of strategies we can try to combat that. And I'm just going to move through some different side effects, but I'd like you to come back and look at these when the slides become available. Nausea, make sure you tell your team the medications can be adjusted, and the timing of taking those medications relative to meals can be adjusted also. The mouth lining, working with that and trying to improve the ability to have foods there. And the low appetite. We particularly, if your appetite is low, want to focus on getting our calories and nutrients and keeping that protein intake up where we want it to be. So try and eat those foods first and try and maximise your intake when your appetite peaks at one point during the day. We can use some of the more concentrated items like protein powder, adding that to food, to smoothies, for example, to try and boost the nutrition if we're able to manage that kind of drink. If drinking works best, there's a range of suggestions here, which I'll have you refer to later on. And with our protein, just reminding you that protein is found in many, many foods, not just the classic ones we know like the meat and the cheese, but a whole range of others. So we want to use that full range of options to hit our protein goals. So all of the different photos shown here can be high protein choices. It doesn't have to be a classic meat and veg kind of meal that you may not feel like. The gastrointestinal disturbances, which is often seen with the medication you might be taking in NM, we want the most easily digested options. That includes some animal protein and plant proteins that I've shown there, and we're aiming to reduce our fibre and use the most digestible vegetables and I've indicated which they are. We also minimise onion and garlic, which can be problematic for many people, and use small serves of legumes. The lactose-free dairy products or some plant milks, making sure they're calcium and protein fortified, could be beneficial as well. Keeping hydration up with water and electrolytes is important there too. Food hygiene, at the basic level, it's the hand washing, sanitising, especially with COVID there, removing the outer leaves, scrubbing off the dirt, making sure all our kitchen is kept clean, rinsing our fruit and veg under cold running water. Sometimes people recommend using a soap or dishwashing liquid because of COVID, but normally that's not required, and cutting off any damaged parts. We also look at making sure we're great at keeping things in the fridge, keeping things cold, putting leftovers away right away, and any jars of things we open that we'll use over a long time, keeping them refrigerated. When we go out, that's a bit of a risk area. Order freshly cooked food. Don't take the buffet, the share plates there as well. And it's great, as I used to use some single serve condiments, not condiments that sat around for a long time. Definitely don't have the food samples, please. They might have sat there too. This will be here for your own, for yourselves to look at. The neutropenic diet, which may be advised for you if you're having a bone marrow transplant or stem cell work there. And these are the requirements, of that. And some oncologists use it, some don't. So do take the advice of your oncologist. Some might just say, follow the previous steps, but be very cautious with that. The last thing that I wanted to finish up was a little look at supplements, whether it's nutrients, plant chemicals, probiotics, whatever. Let's have a chat about that. The nutrient supplements, we will be testing your blood along the way to see if you have got too low levels of some of the commonly depleting nutrients in your blood. So the B12, the folate, zinc, iron, vitamin D, and some others your oncologist may order. And we definitely want to use the supplements to correct those deficiencies. If you're avoiding animal foods, you might like to use flaxseed oil there for the omega-3 fats. If you're perhaps some fish oils, if you're not a fish fan, but you're happy to take those. And if you're really not someone that's consuming the calcium fortified plant foods or the dairy, you may require a calcium supplement. With general supplementation, people often ask about taking high dose this, high dose that, a supplement of whatever. The problem is there can be unintended consequences. These are possible, as are benefits are possible. The benefits of some supplementations are in trials at the moment for actually when we're undergoing treatment. In the past, we've also had the situation during the 90s where big groups of cancer patients and the general population were put on high-dose vitamin supplements. Thousands of people, like running trials, we thought we were onto it, the antioxidant supplements, but all of the trials had to be discontinued because the cancer rates soared. The progression was increased in those protocols. So we now view things very cautiously. So we are finding more and more out all the time, but basically we want to double check that anything that people take, they are aware it could alter the cancer treatment efficacy. It could, as much as helping with their situation, it perhaps could drive cancer growth. So we have the opposite situation to the limiting cancer growth that we want. It could perhaps progress the cancer more quickly. So we are very cautious with that. And just one thing I wanted to point out, because I get asked about probiotics a lot. The first study that looked at the link between immunotherapy and the gut microbiome was done in the US at the Parker Institute for Cancer. And it was 113 individuals with metastatic melanoma, and they were on treatment. And what was found with this particular class of immunotherapy, which is the new area of cancer treatment, was that the taking over-the-counter probiotics correlated with a 70% lower chance of responding to this treatment. So again, this is what we're finding out. We don't have all the answers around this. So when people ask about probiotics, I say, please be cautious with that. So in finishing, the food-based approach gives us no toxicity and many, many benefits for your whole body. Cancer doesn't occur in isolation. We want your whole body to work well. Gradually making changes to improve your 5 food group eating is a good way to go, and focusing on the inclusions. If you need some added assistance with that, seeing a dietitian will help individualise a menu plan for you with your preferences, looking specifically at your side effects and fitting in with your lifestyle, and many offer in-person and telehealth consults. So I really think I'm out of time now, and I'll throw it over to our hosts to take some questions.
Thank you very much, Clemency, that was a really highly informative and enlightening talk. It's impressive to hear about the research being done in this area and the resources that are available for people to access as well. So thanks for sharing that with us.
Yeah.
The question about sugar and avoidance of sugar in terms of it being a fuel for cancer cells is often asked. So thanks for clearly addressing that in your presentation. We have had some questions coming through from our community now, if you're happy to take them.
Yeah, sure.
So we've had a few really good questions come in. The first one I've got for you is, can you address dietary considerations when the kidneys are affected?
Yeah, so with kidney function, your specialist will be measuring your blood levels of various chemicals in your body, your sodium, potassium, your protein level, and so on. And they may put you on a special diet as a result of that to assist with the functioning of your kidneys. But until that time, or should that not have occurred, and you just need to eat well for kidney health, it is this five food group based eating plan that we would do. Having the protein intake there that's recommended, but not exceeding that. So not jumping up to have massive protein intakes, that wouldn't be recommended if you're having some issues with your kidneys. But we do want to meet our 5 food group serve numbers and then be advised by the specialist that's looking after our kidney health when we need to modify our intake perhaps of some other nutrients if they're starting to rise in the blood. I hope that answers the question.
Yeah, it does. Thank you. That's common sense, and having that guidance there is always really important. So thank you for that. And another question that's come through is, are organic vegetables or fruit a better or healthier choice?
Yeah, that's something that comes up a lot. Obviously, people would like to do the best things for their body. It's a difficult area to research in terms of looking at either cancer development or cancer progression, etc. With the development of cancers, sometimes people try to do studies and look at intake historically. So over the last 20 years, what's been your intake in the population group there, and what's the levels of cancer and things. Difficult to do. How do you get accurate information? In general, we don't see a lot of differences in cancer diagnosis rates there. In terms of eating like that after cancer has been diagnosed for someone, we just don't have the evidence suggesting that is more beneficial than using the conventionally grown produce. What we do know is that the majority of the benefits with lifestyle changes with cancer come from eating our balanced diet with conventional produce, as well as being active, as well as not smoking, as well as limiting alcohol intake. So there's sort of the lifestyle interventions we do. Whether or not eating organic produce to that is something further. We just don't have the evidence. Having said that, of course, we will have lower residues, synthetic pesticide residues in organic produce. That is the goal of that. And you may choose to include those foods in your diet. We struggle to recommend that, A, for lack of evidence, but also because of the cost prohibition of those foods for most people. So there is no need to go organic if you are not doing so. And if you are doing so, that's absolutely fine. We just can't say that whether or not there is a benefit to you in doing that with regard to cancer survival. If that answers it.
Yeah, it does. That's great, Clemency, and potentially there may be a peace of mind kind of factor there in some form as well.
Yes.
We have time, I think, for one more question. So the one I've got that's come through is, can you recommend any immune boosting foods and nutrition that might aid neuropathy symptoms? And I know you did touch on the immune boosting side of things later in your presentation.
Yeah, certainly with regard to immune boosting, it is that balanced diet and it is hitting your goals. And people think, oh, I'm already doing that. But generally we find actually we're not. We might several days a week hit those target serve goals, but not 7 days a week. And so the benefit we get from really working to hit those serve goals each day is huge. So do try and do that. Remember too that the other things that benefit the immune system are those other factors not related to diet. So getting the sleep, having the sunlight, getting that vitamin D exposure, and obviously having your blood levels checked around your vitamin D status as well. Being active and including small amounts of alcohol, not smoking. Those are our main things we can do, but particularly the activity, the nutrition, the sleep, the sunlight, those kind of measures will boost immune function. And what was the second part of that question, sorry? Sorry, what was the second?
Yeah, sorry, it was
just
about addressing the neuropathy.
Sorry, yes.
That often,
yeah, and again with neuropathy, we don't have a lot of evidence on that. Sometimes ask the oncologist just to check like your B vitamin status there, because that can be something that if that's low, that can affect that. So particularly the B12 level in your blood. It's good to know that that's sitting okay, and the folate level, which they will look at in your bloodstream there. Otherwise, again, it's back to making sure we meet those daily nutrient requirements, keep everything targeted at meeting our food group serve goals is the best advice we can have, as well as the other lifestyle interventions that we mentioned there.
Yeah, thanks very much, Clemency, for those answers, and also for sharing your time with us today.
Yeah, that's
providing that really useful information. I think we could all take home and put into practice. On behalf of Myeloma Australia and Narelle and I hosting here in sunny Perth, I would just like to thank once again both of our fantastic presenters today, Debbie Cooper and yourself, Clemency Nicolson, and also to all of you from the myeloma community all across Australia for joining in today's seminar. Keep an eye out for more information regarding upcoming seminars and other events via our website at www.myeloma.org.au, either by visiting or by subscribing to receive notifications of future events. And you can also follow us on social media. Simply search for Myeloma Australia and click the follow. You can watch your seminar again via the Myeloma Australia website seminar page. And also, if you didn't get a chance to ask a question, please email us, and we'll be very happy to pass it on to our speakers today and share those answers with you. So please do that. Contact us by email or by phone. For those that registered online for today's event, please keep an eye out on your inbox for an evaluation form. We always appreciate and learn from your feedback, and it helps us to plan future content that is relevant to you. So that's all for today's event, and I'd just like to thank you all once again and our speakers, and we hope to catch you later in the year. Thank you very much.